in the nation. Now, we'll be providing you simultaneous interpretation in the English language. The briefing by the Director of Korea Centers for Disease Control and Prevention. We expect the KCDC chief to brief the public on the latest COVID-19 infection trends in South Korea, elaborate on the government's decision to extend the tighter 2.5 level social distancing restrictions in the Greater Seoul area for another week, and level 2 for the rest of the nation for another 2 weeks nationwide. Now, the briefing has been pushed back a few times today. This is a daily briefing that's been ongoing for months now as the COVID-19 situation has progressed in South Korea. But this is really one of those few times that the daily briefing has been pushed back a number of times. And earlier on, the health minister announced that the stringent social distancing measures in the Greater Seoul area will be extended for another week or so, and the level 2 distancing measures in nationwide will be extended for 2 weeks. The Education Ministry did a follow-up briefing which said that all kindergarten to elementary to middle and high school will turn to remote learning. Now let's turn over to the Korea Center for Disease Control and Prevention briefing by Chung Eun-kyung.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of September 4th, midnight, we have a total of 189 new local infections and 9 new imported cases. The total caseload now stands at 20,842. And 254 more people have been discharged following full recovery, while 4,728 people are in quarantine. There are 157 critically ill patients. We had 2 additional fatalities, and I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now look at the updates on the domestic infections by major clusters. And related to Sarangjil Church in Seongbuk-gu District, Seoul City, we have 13 additional cases. We have a total of 1,152 cases to date. And in relation to Sarangjil Church, we have further transmissions at 11 religious facilities and also 4 nursing hospitals, and a total of 27 venues nationwide. And we have seen 193 confirmed cases of further transmission stemming from this church. And related to the Liberation Day Seoul rally, we have 11 more cases, and in total we have 473 cases being confirmed to date. And in relation to the further transmissions, we also have 2 health clinics and a total of 11 venues that have been stemming from these rallies, and we are conducting our investigation right now. And in relation to the Seoul Asan Medical Hospital in Songpa-gu District, we have a total of 6 people being confirmed, and they include patients and the family members of the patients. And in relation to the Haemin Hospital in Gwangjin-gu District, Seoul City, we have 6 additional cases being confirmed. In total, we have a total of 16 cases being confirmed to date. 10 of them are staff members and 2 patients, and 4 are their contacts and their family members. And in relation to a children's bookstore and book company in the Namyangju City, Gyeonggi-do Province, we have a total of 5 cases being confirmed, and all of them are staff members there. And in relation to an indoor food truck in the Asan City, we have also conducted the epidemiological investigation. We have a total of 5 cases to date, and 1 of them is the manager, and another one was the staff member, and 3 were visitors. And in relation to a kimchi factory in Chungcheongnam-do Province, we have a total of 22 cases being confirmed right now. 19 of them are the employees, and 2 are also their family members, and 1 another contact. And in relation to a health supplement group gathering in Daegu City, we also have 10 more cases being confirmed. In total, we have 25 cases being confirmed to date, and 21 of them are the attendees of the meeting, and the rest are the family and contacts. And related to the office related to a real estate auction in Yeonjae-gu District, Busan City, 2020, we also identified 8 additional cases. In total, we have 13 cases being confirmed to date. And here are some updates on our the patients on quarantine. We have an increase of the quarantine patients by over 2,000 during the past few weeks. And we also have a total of 4,728 people in quarantine, which is down by 58 from the day before. And we have about 19% of them in the 50s. And also there are age groups of the 60s and 70s. And we also see a high portion of the people above the age group of 60. And among the people who are in quarantine, we have 154 patients in critical ill patients, and 37 of them are above the age of 80, and 30 of them are age of 60, and we have a high portion of the people who are aged over 60 and above. And for your information, as for the severe or critical conditions, we are classifying those people with people who need intensive care, including those like ECMO and also oxygen treatments as well. And these oxygen treatments refer to the severe conditions as well as the ECMO and other ventilators, as well as other treatments are also classified as those with critical conditions. And we have the standards set by the WHO that we are utilizing here as well to classify these patients. And not all of these critically ill patients are currently administered at the intensive care unit, so there is a difference in the hospital beds that are used right now. And we ask for the people with high risk in the high risk category to refrain from going to high risk groups, high risk facilities that is. And we also ask you to refrain from going to any facilities and any information sessions that are carried out by door-to-door sales facilities, especially the real estate auctions or those related to bitcoins, or also those related to health supplements. And in relation to these door-to-door sales facilities, we have seen a large cluster of infections, and among them, most of them were aged over the age of 60, and we have a high portion of these people being confirmed at these meetings because the senior elderly groups, they have a high risk of developing critical conditions, so we would like to advise you to refrain from these meetings. And during the weekend, we ask all of the religious facilities to switch to non-face-to means, and please note that you shall not have group meals together, and also refrain from having group gatherings as well. Moreover, if you have fever or other respiratory symptoms, and if you do not feel well, please get tested as soon as possible by visiting a nearby screening clinic. And in the metropolitan area, we have been putting in place intensified quarantine measures, intensified social distancing measures, and this will be extended until September 13th. So we ask the residents living in the metropolitan area to comply with our intensified measures. And in the metropolitan area, when you are using other restaurants, please note that from 9 p.m. to 5 a.m. the following day, dining in services is not available, so utilize takeout and delivery. And as for the franchise coffee shops, only delivery and takeout is possible. And also this measure has been extended to also include bakeries, ice cream shops, and dessert stores in the form of franchise as well. So please take note of that. And all of the indoor sports facilities, including table tennis and so forth, they will be put on to continued closure. So please utilize outdoor spaces or your home for working out. And during the weekend, please note that meeting with others and increasing physical contact could also increase the risks of infection. So please refrain from having gatherings and meetings as well. And please stay home safe and sound with your family members. And if you have to step outside and when you meet with other people, please wear your face mask at all times. And when you wear your wear face mask, you need to cover your mouth and nose completely. And also you need to keep a 2-meter distance with others wherever you are. And please refrain from going to confined, crowded, close contact environment that are poorly ventilated. And we also ask you to continue to comply with the quarantine measures. And thanks to your support so far, we are seeing a downward trend of the COVID-19. However, we have nearly 200 on-day cases on a daily basis. And we also have many cluster infections at diverse venues, including office spaces, sports facilities, health clinics, and also door-to-door sales facilities. And all of these venues are classified as daily venues that are frequented by many people, and we believe that there are many risk factors right now, and we believe that it is a very critical moment that we need to contain the virus going forward. And if we do not contain the virus now, we have a high risk of the virus spreading at an exponential pace in the near future, and it is very important for us to cut all chains of transmissions at this point. And please note that you can be exposed to the virus at any place, at any time. And when you are outdoors, please wear your face masks at all times, and also wear your face mask indoors as well. And minimize your social contact with others. And as for those in the high-risk group, like senior citizens or those with underlying illnesses, you need to also have more protection of yourselves and take particular precautions. And right now, our priority is to contain the local chain transmissions. And please note that COVID-19 is a disease that yourself and your families and it can be infected. And please note that it will affect your children and also the self-employed and also the nation's economy as a whole. And please never forget this. And with the prolonged COVID-19, we believe that many people are experiencing great level of fatigue. However, we were able to stay united, and we had exerted a sense of solidarity, and we have overcome the previous crisis. And we believe that this time we can also overcome this crisis with the cooperation. And please continue to take part in the quarantine measures going forward. And please stay home as much as possible. And when you meet with others, please wear your face mask, please wash your hands on a regular basis, and also keep 2 meters of healthy distance. And we will also vouch to make our exerted efforts to continue to flatten the curve going forward. And we will also exert our full efforts to this end. Thank you very much.
All right, that was the KCDC Chief Dr. Chung Eun-kyung on the latest COVID-19 situation in South Korea. This wraps up our live coverage of the government's daily briefing, but tune into Arirang News at 5 p.m. Korea time for more details. Bye-bye for now.